In this lesson, we will learn about the features of the Brava Plus system. The Brava Plus system consists of Brava Independent Movers, self-engaging brackets, and indirect bonding trays. Brava Independent Movers are attached to every tooth in treatment for predictable, simultaneous, and continuous tooth movement. Brava features flexible arms made from nickel titanium that move teeth from their initial position to their final position. At the top of each arm is a rectangular clasp that easily inserts into brackets bonded to the lingual side of the teeth. Once the clasps are fully engaged, the flexible arms express planned torque, tip, rotation, and space management all in one continuous motion until the flexible arm becomes passive. There is no play between the fully engaged clasp and the bracket, so teeth move predictably and efficiently towards their final position. Flexible arms are made from nickel titanium and feature shape memory. They become active when stretched, and teeth move gently and continuously throughout treatment until the arms are passive. Each arm extends from an anchorage base, which is oriented on the lingual near the tooth's center of resistance. When all brackets are engaged, the anchorage base rests about 1 millimeter above the soft tissue. So all tooth movement comes from light, continuous forces, which also enhances patient comfort. Patient identification is denoted on the anchorage base of each Brava to avoid mix-ups. For more complex cases with 2 stages, marks are placed on the anchorage base to identify the first or second stage. Not only do Brava Independent Movers straighten teeth independently and simultaneously, they work 24 hours per day with minimal impact on the patient's active lifestyle. And because of its innovative biomechanics, patients do not need to visit the doctor as frequently. Brava works fast because torque, tip, and space closure begin on day 1 of treatment. Now let's take a closer look at the self-engaging brackets. In the Brava Plus system, all brackets are self-engaging and are custom fit to each tooth. To enhance patient comfort, all brackets feature a rounded, smooth surface. To maximize bond strength, each bracket features an 80-gauge mesh pad. Each bracket features a vertical slot that fully engages with the clasp when inserted using a lingual Weingart instrument. Once engaged, there is no play between the bracket and Brava Independent Movers, which makes tooth movement more predictable. With no gates to open or close, brackets can be quickly engaged and disengaged. Mesial and distal tabs securely hold each clasp and protect it from the tongue. To prevent mix-ups, each custom bracket features tooth identification in between the tabs. The Brava Plus system features IDB trays that deliver a precise fit with easy removal. Lower IDB trays are segmented to reduce unwanted debonds by improving moisture control. Upper IDB trays come in one piece, but can be segmented like the lower tray when crowns are tipped in lingually and prevent the full tray from inserting properly. IDB trays feature visual identification marks for patient and tooth identification, as well as a midline mark to assist with tray positioning. The flat occlusal ledge of the IDB tray provides a visual confirmation that the tray is fully seated. If a tooth is not fully seated in the tray, then the tray will not appear flat, which helps to avoid positioning mistakes that can delay treatment. The design and tight fit of the tray ensures that brackets are positioned correctly at each bonding. The components of the Brava Plus system offer a lot of benefits. 1. They're custom fit to each tooth on every patient, so they perform predictably, avoid occlusal contacts, and brackets can be rebonded with ease. 2. All bracket surfaces that contact the tongue are rounded smooth for improved patient acceptance. 3. The bracket's unique design simplifies the insertion of Brava using lingual Weingart pliers. 4. Unlike lingual systems with sliding mechanics, Brava Independent Movers are fully engaged in the bracket slots from the first day of treatment, so tooth movement begins immediately. 5. With all these time-saving features, patient visits are less frequent and progress appointments are short. Now we will discuss the patient kits. The Brava Patient Kit box provides everything needed for a successful start of treatment. The upper arch container includes the upper Brava and the upper IDB tray with pre-inserted brackets. The lower arch container includes the lower Brava and lower IDB trays with pre-inserted brackets. Each patient kit includes a treatment plan summary, which lists the clinical conditions to treat, instructions from the Bria's clinical team, the bracket engagement order, and the IPR values for each tooth where enamel reduction is planned. Each patient kit includes a treatment guide, which provides helpful information for each type of case, including a chart that lists what to do at each appointment. The treatment guide also provides a success checklist with helpful tips and QR codes that provide access to additional information. Each treatment guide shows the engagement order by tooth. Following the recommended engagement order simplifies the insertion of Brava clasps into brackets. Each kit includes printed instructions that are designed for your patient. There's advice on how to adjust to Brava, the importance of good oral hygiene, and how to properly care for Brava. A QR code appears on the back of the brochure, which takes the patient to an instructive video about their Brava journey. Make sure each patient receives this brochure at the end of their initial bonding appointment. Some cases have unique clinical conditions where a technique guide is beneficial. A printed technique guide is provided in the Brava Patient Kit when these clinical conditions are present. Some cases may have more than one technique guide, or none at all. For complex cases that are staged, Bria's often ships both stages at the beginning of treatment. The Stage 2 box includes an orange upper and lower arch container with Stage 2 Brava Independent Movers housed inside. Typically, the Stage 2 Brava is inserted after the patient wears Stage 1 Brava for 4 to 6 months. This completes the lesson about the features of the Brava Plus system.